Arrhythmogenic right ventricular cardiomyopathy is a genetic condition that affects the heart in which fat gets abnormally stored in the heart muscle, causing reduced heart function. This is important because some patients can go on to develop heart failure and irregular heartbeats, which can eventually lead to death. In this study, we looked at echocardiograms of patients who had ARVC, and we in particular looked at a novel imaging parameter called right ventricular strain, which measures heart function before the onset of symptoms. So strain, which is worse, indicates that the heart isn't functioning as well. So what we wanted to do in this study was to determine if this measure of strain could predict patients who had progression of their heart disease over time before they develop symptoms. We found that the measurement of right ventricular strain on echocardiography at baseline echo for ARVC patients was strongly predictive of right ventricular disease progression over a period of at least 1 year. It was the most predictive out of all the right ventricular imaging parameters and may suggest that increased screening and earlier performance of RV strain may indicate the patients who are most at risk for developing some of the cardiovascular complications of ARVC. The next stage of this study will be to determine if this novel imaging parameter of right ventricular strain can predict actual cardiovascular events. Primarily, we're interested in the development of heart failure, irregular heartbeats, deaths, and shocks in internal cardioverter defibrillators. In addition, I think in the future, clinical trials can focus on the use of imaging parameters such as strain to see if patients should be started on cardiovascular medications at an earlier stage of disease before they develop symptoms, some of them including irregular heartbeats in the ventricle, which can lead to death.